Stem Cells 105. Frequently Asked Questions Continued, Part 5. This presentation was prepared by Dr. Max McLeod, D.O., N.D., Ph.D. Doc Max is also known as the Nutrition Ninja Doc. He's devoted over 5 decades to studying health and health optimization while being in clinical practice since 1979. He has 3 postgraduate degrees in the health sciences and is a contrarian, always looking for better ways to help people overcome their health challenges and achieve their health goals. He has been doing regenerative injection therapy since 1993 and has added human tissue products including stem cells, growth factors, collagens, and cell signaling molecules over the past several years. As part of our continued series on stem cell frequently asked questions, we have taken some of the top questions from the top results of online searches. The website, questions, and answers will be cited, and Doc Max will provide comments and corrections as appropriate. This is a continuation of FAQs from Washington University Physicians website. The comments are by Dr. Max. Q&A number 9. How hard is it for scientists to make the cells into treatments? It's hard work. First, cells must be coaxed into becoming the desired cell types. That process is called differentiation. For example, researchers have successfully used chemicals to turn embryonic stem cells into neurons, beating heart cells, insulin-producing islet cells, and others. But the process of differentiation for the myriad cells in the human body is an extremely complicated one that scientists are only beginning to understand. Getting the cells to do what doctors want once they're inside the body is a huge challenge. Second, scientists have to find a way to prevent cells from being rejected by a patient's immune system. For some therapies, matching the cells to patients could be similar to the way doctors match bone marrow when performing transplants. Comment by Dr. McLeod. All the latest research seems to contradict what the physicians from Washington University are saying in the answer to this FAQ. We do not have to coax stem cells into becoming specific cell types. That is counter to the entire concept of using stem cells. Stem cells, or more appropriately, parasites, are associated with various organs and therefore have a proclivity to become cells appropriate for that organ based on their environment. In the case of using umbilical cord stem cells, they possess no such proclivity and can become virtually any cell type needed. As they encounter damaged tissues, they will divide into 2 daughter cells. One will be another stem cell and the other will become whatever cell type is needed for repair. Q&A number 10 for Washington University physicians. What are the obstacles that must be overcome before the potential uses of stem cells in cell therapy will be realized? Some of the promises of stem cell therapy have been realized. A prime example is bone marrow transplantation. Even here, however, many problems remain to be solved. Challenges facing stem cell therapy include the following. Adult stem cells, tissue-specific stem cells in adult individuals tend to be rare. Furthermore, while they can regenerate themselves in an animal or person, they are generally very difficult to grow and to expand in the laboratory. Because of this, it is difficult to obtain sufficient numbers of many adult stem cell types for study and clinical use. Hematopoietic or blood-forming stem cells in the bone marrow, for example, only make up 1 in 100,000 cells of the bone marrow. They can be isolated but can only be expanded a very limited amount in the laboratory. Fortunately, large numbers of whole bone marrow cells can be isolated and administered for the treatment for a variety of diseases of the blood. Skin stem cells can be expanded, however, and are used to treat burns. For other types of stem cells, such as mesenchymal stem cells, some success has been achieved in expanding the cells in vitro, but application in animals has been difficult. One major problem is the mode of administration. Bone marrow cells can be infused in the bloodstream and will find their way to the bone marrow. For other stem cells, such as muscle stem cells, mesenchymal stem cells, and neural stem cells, the route of administration in humans is more problematic. It is believed, however, that once healthy stem cells find their niche, they will start repairing the tissue. In another approach, attempts are made to differentiate stem cells into functional tissue, which is then transplanted. A final problem is rejection. If stem cells from the patients are used, rejection by the immune system is not a problem. However, with donor stem cells, the immune system of the recipient will reject the cells, unless the immune system is suppressed by drugs. In the case of bone marrow transplantation, another problem arises. The bone marrow contains immune cells from the donor. These will attack the tissues of the recipient, causing the sometimes deadly graft versus host disease. Pluripotent stem cells, all embryonic stem cell lines, are derived from very early stage embryos and will therefore be genetically different from any patient. Hence, immune rejection will be a major issue. For this reason, iPS cells, which are generated from the cells of the patient through a process of reprogramming, are a major breakthrough, since these will not be rejected. A problem, however, is that many iPS cell lines are generated by insertion of genes using viruses, carrying the risk of transformation into cancer cells. Furthermore, indifferentiated embryonic stem cells, or iPS cells, form tumors when transplanted into mice. Therefore, cells derived from embryonic stem cells, or iPS cells, have to be devoid of the original stem cells to avoid tumor formation. This is a major safety concern. A second major challenge is differentiation of pluripotent cells into cells or tissues that are functional in an adult patient and that meet the standards that are required for transplantation-grade tissues and cells. A major advantage of pluripotent cells is that they can be grown and expanded indefinitely in the laboratory. Therefore, in contrast to adult stem cells, cell number will be less of a limiting factor. Another advantage is that given their very broad potential, several cell types that are present in an organ might be generated. Sophisticated tissue engineering approaches are therefore being developed to reconstruct organs in the lab. While results from animal models are promising, the research on stem cells and their applications to treat various human diseases is still at a preliminary stage. As with any medical treatment, a rigorous research and testing process must be followed to ensure long-term efficacy and safety. Comment by Dr. McLeod. I'm sorry to say that most of the answer to this question by the Washington University physicians is very misleading, as they chose to refer specifically to bone marrow transplants, which was not part of the question at all. Q&A number 11 from Washington University physicians. When will stem cell research lead to new disease cures? Adult stem cell-based therapies are already in widespread clinical use and have been for over 40 years, in the form of bone marrow transplants. These procedures, used to treat leukemia, lymphoma, and inherited blood disorders, save many lives every year and demonstrate the validity of stem cell transplantation as a therapeutic concept. New clinical applications are being explored using stem cells for the treatment of multiple sclerosis, cardiovascular disease, stroke, autoimmune and metabolic disorders, and chronic inflammatory diseases in addition to blood cancers. While human clinical trials have begun in many of these applications, it may still be a matter of years before these treatments become widely available to the patient. Nevertheless, we are optimistic that successes will be possible, and that new stem cell-based treatments will become available as they complete clinical trials. Comment by Dr. McLeod. As stated elsewhere, stem cell therapies are extremely disruptive to the existing medical industrial complex, big pharma and medical device manufacturers. Since they largely control the FDA, it will take at least a decade or two before stem cells are in widespread use. If they get their way, it may take longer in the US. There have already been over 74,000 published studies. Q&A number 12 from Washington University Physicians. Are stem cell treatments safe? That remains to be seen. Potential dangers include: as stem cells renew themselves and can become different kinds of cells, they might become cancer cells and form tumors. Stem cells grown in the laboratory, or adult cells reprogrammed to be stem cells, might have genetic damage. There is also risk in some of the procedures used to get stem cells out of the body, such as from liposuction or spinal tap, or to deliver stem cells to the body, such as implanting them in the heart, brain, spinal cord, or other organs. That's not so much about the stem cells, but because of the procedures themselves. Researchers are studying all of that. Without carefully controlled clinical trials, there's no way to know what might happen in the long term, or even in the short term. That's why the FDA discourages the use of stem cells except in clinical trials or approved therapies. Every medical procedure has risks. A goal of clinical trials is to determine whether the potential benefit of a treatment outweighs the risks. A possible risk of some stem cell treatments may be the development of tumors or cancers. For example, when cells are grown in culture, a process called expansion, the cells may lose the normal mechanisms that control growth. A particular danger of pluripotent cells is that, if undifferentiated, they may form tumors called teratomas. Other possible risks include infection, tissue rejection, and complications arising from the medical procedure itself. Comments by Dr. McLeod. Once again, the answer does not reflect the research. Thousands of studies have clearly demonstrated the safety of stem cells, especially umbilical cord-derived cells versus bone marrow-derived cells. Stem cells should not be grown or expanded in the laboratory, as that can lead to mutations and potential problems. It is also illegal to do so in the US. The other risks only apply when extracting bone marrow or fat cells, neither of which are the best approach. Q&A number 13 from Washington University Physicians. Are treatments using my own autologous stem cells safe? Why should these be regulated? While your own cells are less likely to be rejected by your immune system, this does not necessarily mean the cells are safe to use as a therapeutic treatment. The methods used to isolate, modify, grow, or transplant the cells may alter the cells, could cause infection, or introduce other unknown risks. Transplanting cells into a different part of the body than they originated from may have unforeseen risk, complications, or unpredictable outcomes. Comment by Dr. McLeod. Sorry, this sounds more likely to come from the legal department than a physician knowledgeable about stem cell science. It also sounds like they are running out of good questions and answers. Q&A number 14 from Washington University Physicians. What can I lose in trying an improvement treatment? Some of the conditions that clinics claim are treatable with stem cells are considered incurable by other means. It is easy to understand why people might feel they have nothing to lose from trying something even if it is unproven. However, there are very real risks of developing complications, both immediate and long-term, while the chance of experiencing a benefit is likely very low. In one publicized case, a young boy developed brain tumors as a result of a stem cell treatment. Receiving an unproven treatment may make a person ineligible to participate in upcoming clinical trials. Where cost is high, there may be long-term financial implications for patients, their families, and communities. If travel is involved, there are additional considerations, not the least of which is being away from family and friends. Comment by Dr. McLeod. Sadly, there are very few cures provided by modern medicine, mostly just longer-term treatments. For many conditions, there are no suitable treatments available at all. How can anyone advise someone to sit on their hands and do nothing rather than try something that has been shown to be safe and effective in over 74,000 published studies? Exactly, I can see no good reason for such advice and caution. Q&A number 15 from Washington University Physicians. I have heard that there are clinics offering different types of stem cell treatments. Is this true? Many clinics from all over the world offer stem cell therapies for a variety of diseases. However, many of these treatments are unproven, and in addition, these treatments tend to be very expensive. Comment by Dr. McLeod. Innovative treatments that are counter to what the powers that be considered acceptable are expensive, and that insurance doesn't cover them. Stem cell therapies have progressed greatly at many facilities around the world while the US was in a timeout for political reasons. If you actually compare the costs of such treatments with the costs for many standard medical treatments and operations, you will quickly realize how absurd their answer is. We invite you to learn more about our innovative approaches to helping you optimize your health at ARTC.health. Check out our website at ARTC.health, subscribe to our newsletter to receive future updates, or call us to schedule a consultation. ARTC, Health, 941-806-5511, doc at ARTC.health.